doctor friend of mine. Si Dr. Sharlene Seng. Good morning and welcome sa bahay ni Kuya.
Morning,
It's
Doc.
your first time po, Doc, no?
Yes.
Yes. Si Doc ay actually graduate ng USC, University of Santo Tomas. Diplomate din siya ng Philippine Pediatric Society. Finished her fellowship training in neonatology at the Philippine Children Medical Center. And she's also an active consultant sa Delos Santos Medical Center. Yan. Ang pag-uusapan natin this morning ay ang neonatal sepsis. So, Doc, para sa mga hindi nakakaalam, ano ba itong neonatal sepsis?
Okay, so ang neonatal sepsis, when you say neonatal, this pertains to children less than 1 month. In particular, actually, strict kami, mga 28 days old na baby. And when you say sepsis, this is a bacterial infection of the blood. So it's a bacterial infection of the blood in children less than 1 month.
Paano ito nakukuha usually, Doc?
Okay, so there are 2 types of neonatal sepsis. We have the early onset and the late onset sepsis. When you say early onset, usually the infection came from the mom or at the time of delivery. And when you say late onset, it's from the environment or from the caregiver.
After giving birth.
Oh, yes.
Doc, paano mo malalaman if your baby ay meron na nitong neonatal sepsis? Ano yung signs and symptoms?
Okay, pinaka-early sign usually is yung feeding. Medyo ayaw mag-feed. Or kung talagang nag-feed na siya before, medyo parang napapansin mo na parang this time medyo walang gana. Mahirap gisingin or medyo matamlay yung baby. Medyo subtle lang yung signs.
Medyo subtle lang.
Sa umpisa.
Oo.
Yeah, but later on, they can have symptoms like minsan tumitigil sa paghinga, nangingitim. Yeah, it can be worse like that. Pwede din silang magkaroon ng vomiting, diarrhea, or pwede din silang lumalaki yung tiyan. And also pala with sepsis in the neonate, more on mababa ang temperature kesa mag-fever sila. So yun yung babantayan.
Doc, balikan ko lang kasi you mentioned a while ago, dalawang klase, di ba, yung neonatal.
Yes.
Isa yung nakuha sa nanay, pangalawa yung late onset.
Yeah.
Ilang days po yung onset na
Okay, so when you say early onset, it's within the first week. Of yung symptoms lumabas within the first week. Pag late onset, after the first week, after 7 days.
Pero after 7 days, pero halimbawa, let's say, after 7 days, wala namang risk na ulit na magkaroon within 1 month?
The risk is always there kasi nasa environment. Depende on how you take care of the baby. Yeah. So, nandun pa rin yung risk.
Doc, kasi di ba normally, itong neonatal, you told me earlier, na parang sa mga babies to na 1 month,
Yeah.
kapag beyond 1 month, sepsis na lang yung tawag sa
Yeah.
kanya. Mas delikado ba kapag mas, like ito, sa first month makukuha ng baby?
Yes, because babies, they have immature immunity. So, hindi pa nila kayang yung panlaban nila for infection is not mature at this time. So, pag nakapitan sila ng infection, mas grabe yung effect sa kanila.
So how do you take care of the baby na merong sepsis? Ano yung treatment? How do you manage the pain?
Okay, so this is a bacterial infection. So, the treatment would be antibiotics. Yeah, but antibiotics is half of the treatment. The other half would be the supportive care na tinatawag namin. So, na-mention ko kanina, pwedeng bumaba yung temperature nila. So, you have to make sure na ma-maintain mo yung normal body temperature. Tapos na-mention ko din na hindi sila kumakain. So, you have to give fluids din sa baby para hindi sila mag-hypoglycemia or bumaba yung blood sugar. And the likes yung pang-support ng blood pressure, pagbibigay ng oxygen kung hindi sila humihinga or nangingitim. So, mas maigi talaga na ma-admit sa hospital ang baby na may neonatal sepsis.
Doc, kung hindi siya maagapan, na kung wari hindi agad ma-address itong neonatal sepsis, ano yung worst case na pwedeng mangyari sa
Worst
baby?
case is pwedeng mamatay yung bata.
Yung baby.
Yeah, this is one of the leading cause of mortality.
Yung mortality
Yeah, in children less than 1 month.
Other complications?
So, pwede din kasi this is bacterial infection in the blood, no? So, pwede siyang magpunta sa brain. So, pwede magka-meningitis. So, once you have meningitis, mas grave yung consequences. Pwedeng kahit kung gumaling man siya, pwede magkaroon ng tinatawag natin na neurologic deficit. Medyo mas mababa siguro konti. IQ.
Was wondering, Doc, no? Kasi, di ba, katulad sa mga parents, pinapa-vaccine nila yung mga anak nila, tulad yan yung meningitis. No? So, pag nalaman, kasi di ba may certain age kung paano yung pagba-vaccine ng mga katulad yung meningitis, polio, etc., di ba? When you know na ang anak mo meron ng sepsis and you know that there's a risk na pwedeng pumunta sa brain, can you inject the meningitis vaccine right away o hindi talaga pwede?
Hindi talaga pwede. Kaya may specified lang. Kasi hindi rin kayang mag-mount ng antibodies nung very small babies if you give it too early. So parang wala ding effect yung vaccine mo.
Normally sa dahil bacterial to, bacteria ang nagiging cause.
Yeah.
Doc, sa ano ba usually nanggagaling yan? Sa sa kinakain ba? Sa
Usually,
environment?
like sabi ko sa mom, so kung ang mommy may undetected, like example, UTI, walang prenatal checkup, hindi na-detect, hindi na-treat, so the mom can pass it to the baby. So, importante talaga yung may prenatal check-up yung mom.
Okay, so Doc, sa mga expecting mothers out there or kaya dun sa mga may anak na less than 1 month and na prone nga dito sa neonatal sepsis, ano yung mga maipapayo mo sa kanila?
Okay, so first muna sa mga mommy, important talaga ang prenatal checkup. They have to go to their obstetrician. And number 2, at the time of delivery, mas maganda sana sa hospital or sa facility mga anak. Hindi na po natin na-advise sa bahay mga anak. Opo. And then number 3, for those na nakapanganak na, importante, subtle signs lang. Anything na napansin nyo na parang out of the ordinary dun sa baby nyo, wag nang maggamot-gamot. Diretso na po sa hospital. Pa-check up na po si baby. And importante maging malinis. Hand washing also will prevent spread of infection. Very important.
Ayan. Thank you so much, Dr. Sharlene Seng. At marami po kami natutunan tungkol sa neonatal sepsis this morning. And hopefully, sa mga mothers out there, expecting mothers out there, marami rin silang natutunan. Maraming salamat. And hope to see you again.
Saan siya pwedeng makontak?
Yes. Saan po kayo pwedeng makontak?
So I have a clinic at the Santos Medical Center. It's Monday, Wednesday, and Friday, 10 to 12 in the morning.
There you go. Doc, huwag ka madadala. Balik ka next time.
Thank you. Thank you for inviting me.
Thank you.